video, we're going to cover what rheumatoid arthritis is, the signs and symptoms of rheumatoid arthritis, and its connection to cardiovascular disease. Rheumatoid arthritis is an autoimmune and inflammatory disease. This means that your immune system mistakenly attacks healthy cells in your body, which causes inflammation or painful swelling in the affected area. With this condition, the immune system attacks the lining of joints, which is called the synovial membrane. As a result, the lining of the joint becomes inflamed, which leads to cartilage and bone erosion and largely damages the joint. This tissue damage can cause chronic pain, lack of balance, and deformity of the joint. Rheumatoid arthritis is different from other forms of arthritis in that it occurs symmetrically, which means it affects the same joint on both sides of the body. It typically starts in small peripheral joints like the knuckles and will progress to proximal joints if left untreated. The most commonly affected joints include those in the hands, the knees, and the ankles. However, rheumatoid arthritis can also affect other areas of the body, including the eyes, heart, circulatory system, and lungs. Symptoms of rheumatoid arthritis typically occur in periods of flares and remission. During a flare, the symptoms will get worse, and during remission, they will get better or become less aggressive. The most commonly experienced symptoms of rheumatoid arthritis include pain or aching in more than one joint, stiffness in more than one joint, tenderness and swelling in more than one joint, the same symptoms on both sides of the body, such as in both hands or both knees, swan neck deformities in fingers, ulnar deviations in the hands, weight loss, fever, and fatigue, tiredness, or weakness. Now that we've covered how rheumatoid arthritis affects the joints, it's also important to note how it affects other parts of the body, mainly the cardiovascular system. Rheumatoid arthritis puts individuals at increased risk of developing cardiovascular disease. As a result, individuals have a higher likelihood of having a stroke, a heart attack, heart failure, high blood pressure, or an irregular heartbeat. But why is rheumatoid arthritis linked to these cardiovascular issues? The main culprit is inflammation. Rheumatoid arthritis not only causes inflammation in joints, but also throughout the body, including in the blood vessels and the heart. This inflammation leads to accelerated plaque buildup in the blood vessel walls. It also reshapes the blood vessel walls, making these plaque deposits more likely to rupture. When the plaque breaks off, it can form a clot, which can block an artery leading to your heart, causing a heart attack, or to your brain, causing a stroke. Rheumatoid arthritis also makes individuals more prone to blood clots in the deep veins of their legs, which can travel to the lungs and cause a pulmonary embolism. As a result, rheumatoid arthritis patients experience a 60% increase in cardiovascular-related deaths. They also experience an increase in high blood pressure due to certain medications like NSAIDs and steroids, as well as lack of exercise. They also experience a decrease in the elasticity of their arteries.
Hi, so I'll be going over the prevention and treatment methods for rheumatoid arthritis. So there are medication options available for rheumatoid arthritis treatment, and the most common ones you'll probably encounter are a group of medications called the disease-modifying anti-rheumatic drugs. An important thing to note about these drugs is that they are not designed to give you instant relief. These are long-term drugs that are mostly used in conjunction with other fast-acting drugs to reduce the total number of medications you have to take overall. Some common DMARDs that you may have heard of include methotrexate, sulfasalazine, and hydrochloroquine. Because RA is so closely linked to CVD, it's important to take special care monitoring your heart and blood pressure as a part of your prevention treatment. You want to closely monitor your heart rate and blood pressure, ideally 2 times a day, by taking the average of 3 readings each time. If you would like more information on blood pressure, I would highly recommend checking out our other YouTube video on what is hypertension. There are also other lifestyle changes you can make to lessen your condition. Studies have shown that taking omega-3 can be beneficial in reducing inflammation and managing other autoimmune diseases. Omega-3 is generally found in fatty fish such as mackerel, salmon, or herrings, or there are other over-the-counter pill options available for you out there. Make sure to speak to your healthcare advisor before to see if it would be a good fit for you. So finally, although it may be counterproductive to think that exercise can benefit arthritis, studies have shown that exercise can improve pain and joint function for rheumatoid arthritis patients. Again, it is important to speak to a healthcare professional to see what exercises are right for you and if you can partake in such. For this video, we have prepared just a few simple ones you can try at home, but other than the ones we show you today, there are many other low-impact options for you out there, such as water aerobics and Tai Chi. Things to keep in mind while exercising include listening to your body, adjusting your exercises as you go, and most importantly, keeping a consistent schedule. The main group of exercises I'll be introducing you to is called isometrics. So isometric is a group of low-impact static exercises that are performed without using any joints. They are mostly used to maintain strength rather than to build strength, and when you're doing these activities, people might not even know you're exercising at all. The principle is to isolate and tense a certain group of muscles and hold it for a certain amount of time to kind of build that endurance. We will be starting at 5 seconds for each, but feel free to increase or decrease according to your needs. So for the first exercise, we're going to be doing some breathing exercises, and that's going to work our core. So we're going to just put your hands where you feel comfortable. We're going to breathe in for 5 seconds. And then when you breathe out, you're going to tense your core as tight as you can. So you're going to hold it for 5 seconds. 1, 2, 3, 4, 5. And you can relax. And then we're going to do that again. Breathe in for 5 seconds. And then when we breathe out, we're going to tense our core as tight as we can. Then we're going to hold that for 5 seconds. 1, 2, 3, 4, 5. And then we can relax. And so by tensing and relaxing your core, you're just going to try to build that strength. So the next exercise is another simple exercise, and we're going to try to build our arm kind of like upper chest muscles. So it's called the chest press, except we're just going to be using our hands. So you're just going to put your hands together like this and push them together as tight as you can, and you're going to hold that for 5 seconds. So 1, 2, 3, 4, 5, and then you can relax. You're going to try that again. So again, push your palms together as hard as you can. Hold that for 5 seconds. 1, 2, 3, 4, 5, and then you can relax. And you should feel kind of like a strain in your armpit area. So the next exercise is going to work our shoulders, and for this you need a wall. So what you're going to do is you're going to stand with your heels as close to the wall as possible. You're going to put your head back, and then you're going to roll your shoulders back, press your palms against the wall, and try to hold this upright position for 5 seconds. So we're going to do 1, 2, 3, 4, 5. When you're ready, you can relax. We're going to try that again. So head against the wall, put your heel as close to the wall as possible, roll your shoulders back, press your palms against the wall. I'm going to hold it for 5 seconds. 1, 2, 3, 4, 5. And you can relax. So when you're doing these exercises, feel free to increase or decrease your time as much as you need. Some people go up to 20-30 seconds when they're holding these poses, and other people start at 3. It really depends on your needs. And if you find that these are too easy for you, you can find a bunch of other isometric exercises online, like the wall sit or the plank, that still don't use a lot of joints but are much harder.